After placing your expressed milk in a sterile bottle or disposable plastic bag, date and place in your freezer. You can store breast milk in your freezer for several months. If you are placing the milk in the refrigerator, you should use within a 48-hour period. Bottle feeding. Bottle feeding can be as rewarding as breastfeeding. It gives Dad and the family the opportunity to participate in sharing the closeness and joy of feeding. You may have to try several types of formulas to find the one most compatible with your baby's digestive system. They are cow's milk protein, soy protein, or hypoallergenic. Your pediatrician will advise you on which formula to use. Formulas come packaged in concentrate, powdered, and ready to use. When using concentrated or powdered, you will have to add water. Read label directions carefully. Thoroughly wash all bottles, nipples, and caps in hot soapy water. Use a bottle and nipple brush. Then rinse in hot clear water, or use your dishwasher on its hottest setting. You may also choose to use a sterilizer or boil items for at least 3 minutes. You can safely store formula in your refrigerator for 48 hours. When warming the bottle, we advise not using your microwave since they can cause hot spots. Use either hot tap water or warm the formula in a pot on the stove. Always test the bottle with your wrist before you feed your child. Use a comfortable chair in a relaxed position. Hold the bottle at an angle to prevent air from entering the nipple. Again, burp your baby during feedings. When bottle feeding, your whole family can share in the work and togetherness. Nail clipping.
Sometimes the skin grows right up under the fingernails, so you want to be able to cut the baby's fingernails with the blunt-ended fingernail scissors. It's a good idea to wait until the baby is sound asleep, sit with the baby's back up against your chest, and let the baby's fingers roll around your finger. It's a good idea to sit in the chair where the light is coming in the window so you can see much easier that way. Then you can cut the baby's fingernails very gently with the fingernail scissors. Very gently. Just cut them straight across like that. You have to be very careful. Then you can take a little emery board and you can smooth the corners so that they'll be nice and smooth, so baby's fingernails won't be sharp when he scratches his face. There we go. Nice smooth fingernails. We won't be so apt to scratch. And it didn't hurt at all, did it, Corey?
Crying, colic. One of the most frustrating sounds a new parent can hear is that of their baby crying. Crying is your infant's only form of communicating with you. You will soon learn what your child's cries mean. Babies cry for a number of basic reasons. They can be hungry, wet or soiled, angry or frustrated, tired, in pain or discomfort. After you have attended to the obvious requests, such as feeding, changing a wet or soiled diaper, or just trying to comfort her, you may be thinking of that confusing, horrible word, colic.
Well, colic is that dreaded word for parents and also for some of us physicians. We're not sure exactly what colic is caused by, and there may be various factors. Basically, it's uncontrolled crying, sometimes lasting for hours in these babies, and usually more in the evening and nighttime. The baby is tense, the abdomen is tense, the fists are clenched, and the legs are drawn up. It happens in the first few weeks of life, and gradually, in peaks in intensity, becomes worse in the first 4 to 6 weeks. And then gradually it disappears and diminishes by the time the baby's 3, 4 months of age. So there is hope. Babies are healthy, does not mean the baby's sick, And it's important for us to stress that it's a temporary phenomenon and it will go away.
Sometimes the baby's a little colicky, and if you hold them a special way with a little pressure on the tummy, that helps. So if you can sit the baby with his back up against your chest, bring your arm across his shoulder, put your hand in between his legs, just sort of turn him over like this, with a little pressure on his tummy and pat him on his back like this. Sometimes it helps with the colicky bit, okay? And sort of pat him on the back. Sometimes they like this view because they can see the floor too.
One of the ways to calm a crying newborn is swaddling. Place your baby on a blanket in a diamond-shaped position and fold the top point down a few inches. Put the baby's shoulders on the fold of the blanket. Fold his arms up and take the point of the blanket and tuck behind the baby. Take the bottom point up and tuck it in the same place. Pull the arm up and blanket over. Your baby now feels very secure. If your baby still needs attention, you might try a pacifier, putting her in a swing, or you can play with her to distract her attention. Another way to calm her is to place her in a swinging cradle or crib and gently rub or pat her back. Check to see if your child is in pain or discomfort. Check for signs of fever or infection. Always call your pediatrician or doctor if the problem persists. As the age-old saying goes, if all else fails, remember, this will not last forever. Promise. Taking your baby's temperature.
Now we're going to take the baby's temperature. The thermometer runs from 96 to 106 degrees. If you have trouble reading a thermometer, if you put the solid color side down in the palm of your hand, you can see the silver mercury line coming up from the thermometer. We'll lubricate the end of the thermometer with a little bit of Vaseline. Okay? We'll hold the baby steady so that we don't break the thermometer. We'll insert it into the rectum about 1 inch, and we'll hold it there for 1 minute. Then we'll take it out, and we'll wipe the thermometer off on a cotton ball soaked in alcohol. And we'll read the temperature. It's 98 degrees.
Normal rectal temperature ranges between 97.6 and 100 degrees. If your baby shows signs of runny eyes, nose, or unusual discomfort, it's wise to take his temperature. If the temperature is 100 degrees or over, call the doctor. Basic items to keep in-house. In the event of a minor illness, the following items should be kept in your medicine cabinet: a thermometer for taking temperature, saline solution to keep nasal passages dry, syrup of ipecac to reduce vomiting should your child accidentally swallow any poisons or pills, liquid acetaminophen or a non-aspirin product to help reduce fever as prescribed by